Hi, this is Alessandra Dominguez with ECHO. You will be listening to the coordinated entry training where I will be going over the coordinated entry system. First question you probably are having is, what is a coordinated entry system? It's a collaboration of all the agencies in the Austin-Travis County homeless system where we all collaborate to identify, which is entering them into HMIS and identifying those that are experiencing homelessness or fleeing domestic violence. We then refer them to appropriate housing programs, and then our housing programs house them. All of this is happening within the system while we prioritize those that are the most vulnerable first. Some stages of the coordinated entry system are first, access points. Individuals can access coordinated assessment to enter into the system either by outreach workers, navigation, locations like Sunrise or Trinity Center, or outreach hosts, community health paramedics, or ECHO coordinated assessment assessors or community assessors. Once they have reached an assessor, then we will complete an assessment. Individuals or families will complete basic demographics as well as UDEs, Universal Data Elements. They will then complete the VI-SPDAT as well as equity questions. Then that will determine a score which will allow us, our community, to prioritize their need. Once they're in prioritization, then we wait for our housing referrals. Once housing programs have capacity, we then send whomever is the most vulnerable that day to that agency to be referred out. That agency is then responsible for contacting that individual or family themselves. You may be asking, why are we doing this? So in 2014, HUD required all COCs to start developing within their continuums a way of coordination and a way for a centralized entry point for individuals experiencing homelessness. It was also in recent federal legislation that it was required to remain eligible for certain emergency solution grants. It's also guided by the coordinated entry written standards, which were updated and approved by the Membership Council in 2019. Membership Council also needed to appoint a lead agency to help all the agencies in the continuum of care guide them through the process. And ECHO was appointed to be that facilitator to help the process move. This is a great example of two systems. The one on your left is what Austin-Travis County and many continuum of cares looked like before there was a coordinated entry system. So we know that the goal for those unhoused neighbors is housing, but unsure of how to get them into the appropriate type of housing. So there was a lot of miscommunication, lack of understanding, since every organization had their own eligibility requirements. So it was very confusing for housing case managers, let alone individuals trying to help our unhoused neighbors to get into housing. Now we take a look at the figure on the right, and what we're looking at is that the access points are all pointing to housing. We start talking about housing with an individual right as they come in, whether they are coming into an emergency shelter for the first time, or a navigation center, or an outreach worker. That first conversation is a coordinated assessment, which is the entry into the coordinated entry system. Then in the middle, we have the assistance, where they can access emergency shelter or start a navigation process while we're waiting for either a program to be assigned to them. Self-resolution can happen within assistance in the middle. Diversion is a perfect time to have these conversations as well. There are many options to house people than just thinking of our PSH or our rapid rehousing programs. And that's what the coordinated entry system allows for, to kind of give everybody a basic starting point to allow us to see where we should start working on next with the client's needs. Here are some components of coordinated assessment. It's moving us away from a first come, first serve approach and really taking a look at our community as a whole and making sure that we serve those that are the most vulnerable and chronically homeless. It's using a system-wide tool to guide us to see who is the most vulnerable and who should be appropriate for the type of housing referrals in our community. It also allows to put people on a community-wide prioritization list for permanent supportive housing or rapid rehousing. It's also removing unnecessary requirements that maybe have just been kept in housing programs from time to time. So having a coordinated entry system, it allows each housing program to really take a look at their requirements and seeing which ones are mandated by funding and which ones are just barriers for our clients that we're serving. So it's also shifting our look into more moving towards a housing first model, right? And a housing first model is, just as it kind of says, it's housing those individuals first and keeping them with wrapped around services to make sure that then we can take care of any issues that may have prevented them to be successful in housing in the past. And for data, it allows for an open HMIS system, which is a homeless management information system. Allows us to gather information and not have to re-enter information. So if they come into a shelter and have information added, and then they enter into another navigation center and they look them up, they're able to see the same information, which allows for that client's story and their progress to kind of follow along depending on whomever they needed to work with to help them with their needs. What is the VI-SPDAT? Well, the VI-SPDAT stands for Vulnerability Index Service Prioritization Decision Assistance Tool. It is the intake pre-screening tool that our community has chosen to help us decide whom is the most vulnerable in our community. And it's taking a look at somebody's needs in 4 domains. So those 4 domains are: 1, history and housing of homelessness, how long, how many episodes somebody may have experienced; risk factors, they have interactions with emergency services and or just sleeping outside is risky; wellness factors, physical, chronic health, mental health, and their socialization and daily living functions. Do they have a network? Do they know where to take care of basic needs? From those questions, that allows us to kind of see where, what housing intervention is appropriate for them. It doesn't indicate which intervention they'll be successful at, but it's an indication of what their needs are and how severe those needs may be. So that allows them to go into permanent supportive housing in 8+, go into that range, and or rapid rehousing, 0 through 7. Here are some benefits of the coordinated entry system. It makes the process more objective since we are using data-based information. It identifies gaps and strengths in our systems, and it allows for better collaboration amongst providers, which then allows for a better understanding and having our individuals experiencing homelessness know more of what they're doing within the process. And it maximizes funding and reduces individuals returning into homelessness. Benefits for clients. It allows an individual to access multiple service programs through just one process. It's having a system based on consumer need, not provider specifics, meaning an individual can have a choice on what type of housing would be a good fit for them and what type of service provider that may come from, which then allows that client to make fewer calls and have more of an understanding of what type of housing programs are in the system, which then make for an improved referral to a housing program. Assessment review request. This form can be filled out if by a coordinated assessment assessor, a case manager, or an individual experiencing homelessness themselves. This form is to be filled out if the VI SPDAT maybe didn't really capture an individual's vulnerability, or maybe the client underreported or wasn't able to report successfully and maybe needs a little help, or the client has experienced a significant change since the first time they've been assessed. And a significant change could be maybe they have a new diagnosis that they didn't have previously. Now they have a child in the household, or maybe the child's no longer there. Anything significant like that would make a change in their vulnerability. These forms are reviewed by the Coordinated Entry Administration team every Tuesday, and then are followed up to whomever filled those forms out of next steps. What is diversion? Diversion is the last chance opportunity to help someone avoid homelessness or entering into shelter. It allows them to identify possible alternative housing arrangements that may need flexible funding to help them return to permanent housing. This can happen in multiple stages within an individual's homelessness. Who's appropriate for diversion? Any person that finds themselves experiencing HUD's definition of Category 1 and/or Category 4 homelessness. Category 1 is literal homelessness, meaning an individual or family lacks a regular or adequate nighttime residence. They may be sleeping at a shelter, outside, a place not meant for human habitation, such as a car, an RV without hookups to water or electricity, or Category 4, fleeing domestic violence. This individual or family is actively fleeing domestic violence. They may not yet be in a shelter or in a car, but if they are actively fleeing, they are still eligible for diversion's flexible funds. Coordinated assessment staff or shelter staff or anyone trained in having a conversation with them can help engage them in resources and networks that the individual may have not thought of. That conversation will be utilizing crisis intervention, active listening skills, and professional creativity, and amongst all, empathy, to make sure that we're empowering the client to start thinking of other options that maybe they haven't yet. Here's a look of the diversion program in the Austin-Travis County Homeless Response System. If we start here on the left of the diagram, it shows an individual and/or family finds themselves experiencing homelessness. If they're on the track of option 1, they may have had a conversation with service providers that they left their apartment because they were unable to pay this month's rent. Knowing that, and were able to then communicate with the landlords, possibly able to pay for their rent, which then allows them to skip emergency services and put them back into housing. Now, we know that not all clients may have a diversion or self-resolution plan as they first enter into homelessness, which then we see typically our clients are falling in within option 2, where they enter into the process. We may have had that conversation with them about diversion or self-resolution, but just wasn't there yet. They can come in and access shelter. We can talk about housing planning and take care of their basic needs. They will then also be able to complete a coordinated assessment, which will then see whether or not permanent supportive housing is an option for them or rapid rehousing. The diversion conversation still continues while they're waiting for housing because new opportunities can happen every day. Here are some items that diversion can provide funding for: a gas card to get somebody back home, a bus pass, a plane ticket temporary hotel stays, a grocery gift card, criminal background checks, move-in or moving cost, apartment application deposits and or any application fees, employment supports like workbooks, uniform, certifications, license fees. Also is able to provide money orders for those needing identification documents like birth certificates and government issued IDs, and a criminal background check. Here are some of our results. So since 2015, when ECHO's pilot diversion program first started, we have since then been able to divert more than 500 individuals and families. More than 100 have stayed permanently housed longer than a year. And in 2019 specifically, there were 118 individuals diverted, 69 were men, 29 were women, and 20 children. All those individuals on an average cost were diverted for less than $198. Thank you for listening to the Coordinated Entry and Diversion Training. I'm Alessandra Dominguez, the Coordinated Entry Program Manager. I hope you have a wonderful day.